Live, sir.
Okay. All right. Hi, guys. I'm Dr. Siraj Ahmed, your faculty of pharmacology. And today I'm going to introduce to you someone who has cracked, rather, I should say, that he has slashed the FMG examination in the very first attempt, FMG July 2025. He is none other than Dr. Piyush Rathore. Dr. Piyush, many congratulations to you and welcome to our today's session or today's show that we are going to host you
Uh,
today. How are you feeling?
thank, thank you so much, sir. Thank you so much. It's an honor to talk to you. Yeah, I'm just really happy that I cleared the exam and with a good score. So just
Okay.
overwhelmed.
Okay, tell our audience and our people those who are watching us about your medical college a little bit about the your medical college and was it your first attempt, second attempt, something
Yeah,
about
yeah.
it.
Yeah. So I have completed my MBBS from Maham College of Medicine. It is in Cebu, Philippines, and
Okay,
this was my first attempt, sir.
first attempt. And how much score
Mm.
did you got?
I scored 218, sir.
Wow, that is an excellent score, 218. And getting this score, you can say, might not be very easy. Can you tell me what is the secret behind it, the secret recipe?
Actually, there is no secret, sir. It's just that you have to be consistent in your preparation and like just making every day count. I think that's what matters.
Hmm.
So in the end, you can actually get your dream score.
Definitely, how humble you are and how kind you are being to yourself and everyone. That's absolutely nice. But we can totally understand someone who is getting a score of 200 plus, how much of the grind they have gone through. Uh, let's say that you are one of the student who has cleared this examination right now. If I can ask you that, when do you think that you actually started preparing for the examination in India, जिसको हम बोलते हैं FMG?
Yeah, sir. So I have uh, given good focused 7 8 months for this preparation, sir. Like focus only on FMG. When I came back to India back
Okay.
in September 2024. So after that, I started preparing fully
Okay.
focused.
So September to June you prepared, July mein you gave examination.
Yeah, correct, correct, sir.
All right. So in your medical college, from where you did MBBS, were you able to aware about, no, did you know about that there is something called FMG exist and what is the level of paper that is going to be asked?
Yeah. I was actually aware of the exam and everything
Hmm.
from the start itself, but in my medical college, I didn't get that much time to focus on getting subscription or watching the videos.
But did
But
you focus on the curriculum of the medical college? What I'm asking is कि medical college
yeah,
में
sure.
सारे subject होते हैं, तो were
Uh,
you able to study that from their syllabus, from their day-to-day classes or not?
yeah. I was able to study because actually in our college also the passing percentage was 70%. So we had to study regularly on the regular basis. So
Wow.
I actually had a good foundation.
Yes, that is the main reason I'm telling
Yeah,
that mere 7 month is going to help you definitely, but this
mm,
will only help if you have the background knowledge. And
background knowledge. Okay.
students, in my all the interview, what I'm focusing for all the students that these students they have to start focusing on the syllabus, the background knowledge from the very
Yeah,
beginning. Coming to India and thinking that immediately सब कुछ अच्छा अच्छा हो जाएगा, वो बहुत ही कम कंडीशन में होता है, right?
yeah, correct. Sir. And actually nowadays in FMG they are not asking straightforward basic questions. So you have to have a good base so you can focus in depth on each subject.
Right. Now we are talking. Now we
Mm,
are talking the core thing that is actually needed
yeah,
for the student. Can you elaborate on this that they are not asking one-liners, they are asking
yeah,
clinical question, right? So
yeah,
students
yeah, yeah.
know that if they are going to
Mm,
read, let's say, one-liner question or they are doing
mm,
ratification, trying to mug up
mm.
the whole thing, do you think that is going to help or there should be background knowledge?
No, I don't think just studying one liner and ratification will help because
Yeah.
now even the clinical questions are not just superficial, they are in depth. So
In depth.
it's
Yeah.
like two layered they are asking. Like previously they used to ask like, for example, irregular pulse is in
Huh.
fibrillation, but
Huh.
now they are asking, they are not giving the diagnosis, but they are asking like what GBP waveform is seen in the
Exactly,
case.
exactly. You are talking the core thing that every student should know because But I saw that many students are, feeling very relaxed while they are in the medical colleges. And once they come here, they feel that we are troubled so much, we are haunted by the system. But when I talk to students like you, I actually feel very privileged, and I feel really happy that you have utilized your medical college ka syllabus and the time that was given there very effectively to make a, confidence and to make a base for the FMG examination.
Yeah,
बिकॉज मेडिकल कॉलेज में देखिए पढ़ाई तो होती है, लेकिन मैं थोड़ा सा कहने से हिचकिचा रहा हूँ, है ना, बट मुझे लग रहा है कि अगर पढ़ाई पे जितना बच्चे फोकस कर रहे हैं उससे थोड़ा फोकस और कर दें, जितना चाहिए उतना नहीं हो रहा है, मुझे ऐसा लगता है, बिकॉज वी हैव बीन गोइंग टू कॉलेजेस, जैसे कि मैं आपको ही बताया कि वी आर गोइंग टू कॉलेजेस, मैं आपके सिटी में भी गया हूँ, दूसरे
yeah,
मेडिकल कॉलेज में गया हूँ, वी आर गोइंग टू अदर अदर कंट्रीज ऑल्सो, बट आई फाइंड कि जो स्टूडेंट मेहनत करने वाले हैं वहां पे भी वो यहाँ पे भी आके कर लेते हैं।
जी,
होता सभी का है, एक अटेम्प्ट दो अटेम्प्ट में सभी का हो जाता है, बट थोड़ा सा कई कई बार मैंने देखा है कि बहुत हार्ड वर्किंग स्टूडेंट होते हैं, वो एक दिन उनका बेहतर नहीं होता है, उस दिन वो बढ़िया से परफॉर्म नहीं कर पाते हैं, उस चक्कर में भी कई बार रुक जाता है, लेकिन वो बहुत कम है। क्योंकि देखिए, लेट्स फेस द हार्श रियलिटी, ओनली 20% ऑफ द स्टूडेंट पास्ड,
yeah,
राइट?
right.
अर्लियर दिस नंबर was 7% to 10%. This number has increased from I think 7 years, 6, 7 years. This change
Yeah,
I'm observing. What I'm expecting if the students are going to get benefited from interviews like this and from seniors like you, in coming 2 to 3 years, this number from 20, just in 2 to 3 years, you will see this will be in 40. आज मैं
yeah,
2025 में बोल रहा हूँ, by 2027, 2028, this number will definitely reach out to 40 because awareness बच्चों में जाता जा,
yeah, yes,
राइट, कि पढ़ाई तो करनी है भाई, बिना पढ़ाई किए काम नहीं हो पाएगा।
जी,
In your
बिल्कुल।
medical college, do you used to write your notes? Do you used to make your own handwritten notes?
Not so much actually. I used to read a few standard books and then few notes the faculty in the college itself they used to provide. So I used to follow that, but I
Hmm.
did not make any handwritten notes rigorously or something like that. I
Okay.
just make sure my basics are good. At least I know the foundation of a subject.
Okay. So the basics were
Yeah.
good, and then you used to do the questions, MCQ. What was the source of MCQs?
I used to solve the Q banks, not so much in the, but now when I came back to India, then
Mhm.
I solved a lot of custom modules and then
Mhm.
PYQs related to the topics also, like also for NEET PG PYQs
Okay.
and some INSET PYQs also I have solved.
And your examination in the country is also your examination is also MCQ based, right?
Yeah, yeah, it's MCQ based. There is no written
That
theory.
country there is MCQ based examination, I know, right? So
Yeah,
there is also a practice of solving MCQ already that you have already
yeah,
got from your
yeah.
medical.
It's quite beneficial. Yeah.
Quite beneficial. That is absolutely correct. Okay, tell me something that actually you found difficult during this journey of yours. FMG examination journey में आपको क्या ऐसा लगा कि यार ये difficult होता जा रहा है मेरे लिए? Something, some challenges that you faced.
Sir, actually, challenges was only that it is too vast. Firstly, it's 19 subjects, and then to revise them timely and then finish your 2, 3, 4 revisions on time. I think that's quite challenging. Then making times for your GTs, giving them regularly.
Okay.
Yeah, just sticking to your schedule. Then sometimes you may get 1 or 2 days behind your schedule or
Hmm.
something like that. So
Not
I
able to
think that
schedule on the daily basis, making
yeah,
feeling every time, right?
yeah.
And after giving GT, do you used to revise your GT or just give and forget?
No, no, no. I used to analyze my GT. So, for example, I have given a GT in a day. So, the rest of the day, I'll just analyze the GT and like which subject is weak or something like that. So, it needs more attention. I used to do.
What if some of your seniors or some of your batchmates, some of your friends says कि analyzing GT is not important. Just give the GT and move on. What kind of advice would you like to give them? Because that's what happens
Uh,
nowadays.
I would like to give them advice that analyzing a GT is very important. Firstly, because see, if you do PYQs and PYTs, you are already aware of the topic a little bit. But when you
Mhm.
give a GT, it's a fresh new topic and fresh questions which are asked and framed by good faculties like you, sir. So I think that is more important because exam would be 95% new questions. So you have to have an idea of what new things can be asked.
Okay, very nice. And new thing will also not be from a single subject. It will always be
Yeah,
integrated
definitely. Integrated, yeah.
with
So all
pattern.
19 subjects at once.
You have to have
You
clinical
have to
background.
clinical, yeah. Yeah.
Exactly, exactly. All right. So while you let's say you're saying ki GT is going to be very, very important, and our viewers are definitely listening to you, and they should take into this consideration. Apart from these, if I ask you, what advice would you like to give to upcoming FMG aspirant that what mistakes they should avoid? ऐसी क्या क्या
Yeah.
गलतियां वो कर सकते हैं? You have been in their shoes, है ना? Now
Yeah.
you are on the other side. Some people
Mm.
that are left behind, what kind of advice would you give them?
I would give an advice to them that firstly they should stick to one source, like all sources are good. They should stick to one source for one subject, and then they should thoroughly also keep revising in between. Like active recall and spaced repetitions are very important, so that you don't just forget on the content. Like you move to the next subject and you just forget the one you studied last week.
Right.
That is important, and then solving questions like every day you should at least give 3 to 4 hours, spare your 3 to 4 hours just for questions. Because in the end, it's an MCQ exam and you have to
Exactly.
master it. So the way you keep solving it every day, that's only when you develop the acumen of, guessing the right answer, even if you don't know it completely.
Exactly. Art of
Mm.
controlled guessing,
Yeah.
art of solving MCQ can only be learned with the practice. That
Mhm.
Dr. Piyush has, nicely done it.
Also, sir, I would like to mention that
Yes.
now the aspirant should also focus on the uncommon topics also, because even in this exam there were few uncommon topics that were also asked. So
Can
at
you
least they
give
should,
topics that you can
like
read?
for example, in pathology they never used to ask non-Hodgkin lymphoma or something like that, but they asked the CD markers for it. Then
Okay.
yeah, so use and for biochemistry, for example, they asked urea cycles. There were 2 3 questions on, like we
Wow.
usually like skip urea cycle, but they asked 3 questions from it. So you should focus on all the topics at least from the revision notes.
ओके, ओके,
Yeah.
गुड गुड गुड। चलो, आई थिंक जो भी आपके ये एक्सपीरियंस से जो आपके ये एडवाइसेस आ रहे हैं, स्टूडेंट शुड डेफिनेटली टेक इट एंड दे शुड गेट बेनिफिटेड बाय वट एवर यूर सेइंग। ओके, एक लाइन में ये बताइए, हाउ वाज पीडब्ल्यू मेथड हेल्पफुल इन योर जर्नी?
It was really helpful, sir. And also in the end, like I liked the predictor GTs. They
ओके,
were really helpful. I actually attempted 2 3 predictor GTs and they were quite good. I analyzed them also.
व्हाट वाज योर स्कोर इन दैट जीटी?
Part one, I think 111, and part two, 105. Yeah, something like this only, which I
Something
got.
like this, right?
Yeah,
See, 107, 1011. So that is almost coming 219,
yeah,
right? To 18, 19. So I think you have got almost same because many student after that said कि सर पेपर तो बहुत टफ था। हमने कहा बेटा पेपर ऐसे ही आते हैं आपके। वो बात अलग है कि आपको अदर साइड की कहानी नहीं पता है। जब आप एग्जाम में बैठते हो तो लगता है कि नहीं, कुछ क्वेश्चन तो एकदम बड़े इजी हैं। एग्जामिनर आपको हलवा क्वेश्चन दे रहा है, हल्लो हलवा खाओ। लेकिन 3 4 क्वेश्चन के बाद एक तो बाउंसर आता ही है कि लगता है उप्स ये क्या हो गया, है ना? तो वहां पे पूरा आपको अपना दिमाग लगाना पड़ता है, सब्जेक्ट को जोड़ना पड़ता है। यार मैं तो फॉरेंसिक पढ़ के आया था, पहला लाइन फॉरेंसिक का था और ऑप्शन तो मेडिसिन वाला दे दिया, ये कैसे हो गया, है ना? क्लिनिकल हिस्ट्री मेडिसिन का था और ऑप्शन में इमेज एनाटॉमी वाला दे दिया, अब
yeah,
आइडेंटिफाई करो, है ना? ऐसा भी हुआ आपके
yeah,
एग्जाम में
yeah,
है
yeah,
क्या?
yeah, yeah, exactly.
राइट। सो आई एम प्रिटी श्योर कि जैसे आप हैंडल किए हैं और आपके एडवाइस से स्टूडेंट्स आर गोइंग टू गेट बेनिफिटेड बाय दिस। और पीडब्ल्यू का जो प्रिडिक्टर सीरीज आपने बताया या जीटी बताया, जो भी आपने दिया, तो इट वाज हेल्पफुल। और देखिए जीटी में यूजुअली क्या होता है, स्पेशली जो लास्ट मंथ वाला जीटी होता है, अराउंड द एग्जामिनेशन, एग्जाम के 2 3 हफ्ते पहले वाला जो जीटी होता है, जो स्कोर होता है रफली, ऐसा माना जाता है, नॉट इन 100% केस बट
उसके अराउंड
मेजॉरिटी ऑफ द केसेस उसी के आसपास आपका एक्चुअल भी रहता है। बिकॉज जीटी भी कोई ना कोई एग्जामिनर ही बना रहा
बना रहा
है,
है।
जीटी दे रहे हो तो, है ना? मैं ऐसी बात नहीं कर रहा हूँ कि कोई भी जीटी जो अवेलेबल है टेलीग्राम पे दे दिया, ऐसे नहीं। प्रॉपर जीटी अगर कोई एक टीम बढ़िया बना रही है, प्रॉपर जीटी अगर दे रहे हो, तो वो आपको आपके टैलेंट को डेफिनेटली एसेस करती है ना? चलिए, वेरी नाइस टॉकिंग टू यू एंड विल जस्ट हैव अ रैपिड फायर राउंड विथ यू। कुछ जनरल क्वेश्चन आपसे पूछेंगे रैपिड फायर में, एंड देन विल टेक योर लास्ट वर्ड्स एंड देन वी विल एंड द सेशन। कैन वी
Sure,
स्टार्ट?
sure. Yeah, yeah, sure.
All right. So, what was your favorite subject in the entire MBBS out of 19 subject?
OBGY.
OBGY. Okay, so
Yes.
you like the subject as a whole, or you like, the area as a whole?
Subject as a
Because most of the students, whenever I talk to these guys from Philippines, they all mostly they say OBGYN. I don't know what is the obsession with the OBGYN, but they all like OBGYN. है ना सर, बढ़िया मजा आया सर OBGYN, है ना? सब्जेक्ट एज ए होल का मतलब मेरा स्पेलिंग था WHOLE, W से, है ना?
yeah,
तो
yeah.
यू
Uh,
लाइक WH, राइट? ओके, दैट इज वेरी नाइस. लीस्ट फेवरेट सब्जेक्ट?
Least favorite would be forensic.
Okay, because forensic was not a part of your curriculum, you said?
Yeah, and also it was
Okay, okay. Are you a tea person, coffee person?
coffee person,
Coffee, mountains or beaches?
beaches.
Beaches, right?
Yeah.
So you are from
Yeah.
Philippines, and I think
Yeah.
the place from where you actually read is actually having a balance of both.
Both. Yeah.
Side hill, other side. I have
No,
been to
correct,
college
exactly.
actually. I have not your college per se, but I've been to that city. I have taught to different medical college in that multiple time. I've been there, so I know how beautiful that place is. And as I was telling you over call also, once I felt like that I should settle here itself. And
Mm-hmm.
I was so much in love with the place. मतलब मुझे
Mm-hmm.
दोनों पसंद है. I like let's say 70% hilly area and
Uh-huh.
30%. And एक ऐसा जगह था जहाँ दोनों मिल रहा था, तो मैंने कहा बस है
Yeah.
सपनों का घर.
Exactly.
दैट इज वेरी नाइस. चलो, ये बताइए, व्हाट टाइप ऑफ टाइम डू यू चूज फॉर योर स्टडीज, लाइक नाइट में, अर्ली मॉर्निंग, व्हाट काइंड ऑफ पर्सन यू आर?
I would stretch until 2 a.m., 3 a.m. in the night. So I'll say night person.
अच्छा, नाइट पर्सन यू आर, एंड
Mm-hmm.
मॉर्निंग में देर तक सो के उठते हैं.
Yeah, but I changed it like 1 month before the exam because you have to be active in the morning.
Active in the morning, yes, that is what that you have corrected, and that is very nice thing that you have done. Okay, just one word to describe your FMG journey in one line, you can say, how can you describe your journey of FMG?
Challenging, I would say.
Challenging. Okay, very nice. But you faced it and you have slayed it like a true warrior.
Yeah. Thank
Absolutely
you.
nice. चलो, एक क्वेश्चन आपसे ये पूछते हैं. When you checked the result day before yesterday, I think the result came on the 30th, if I'm not wrong.
Yeah, yeah, yeah.
When you saw the result pass,
Mm.
can you describe that feeling?
Yeah.
Or
I
you
was
are
just
okay कि मैं पास तो हो ही जाऊंगा?
Yeah, I was sure that I would pass, but the score, I was not expecting that I
Not
would
expecting. So
get
when
a
you
high
saw
score.
that
So
score, what was your feeling?
I was really happy, overjoyed, I would say.
Very nice. And what was the response of your parents?
Yeah, they were really happy. They were
Very,
really, really happy.
very nice, very nice. Any message for your friends, juniors, or other student? Let's say 80% of the student, those who could not clear. What is the message that you would like to give to them?
I would just say that it's not the end of the world. You can give it again, and then you should just keep the good mindset uh,
Mm.
that you will pass it the next time, and then you should focus more on revising it timely, like use active recall and spaced repetitions, and focus on the content that is also like non-common also because they are asking it nowadays,
They're
and
asking.
solve as many clinical questions as you can.
Clinically integrated question they have to solve,
Yeah.
and this is not the end of the world. It is going to
Yeah.
happen. But I have seen, Piyush, that if a student is not able to do in one attempt, in coming days they used to do
Yeah.
it. पास हो
Yeah.
ही जाते हैं,
Surely,
कोई
surely, surely.
हो ही जाते हैं, है ना?
Surely.
चलिए, वेरी नाइस. आपका फेवरेट ब्रांच क्या है? इसके आगे क्या क्या प्लान है, मतलब 5 year डाउन द लाइन, वेयर डू यू सी योरसेल्फ?
I would say pediatrics.
Pediatrics is your favorite branch? I thought you will say I will be the best gynecologist of Indore. Pediatrics,
uh,
you like to be
Pediatrics.
pediatrician. Okay, chalo, very nice, very nice. I am pretty sure that the kind of interaction that I'm having with you, Piyush, is going to help a lot of the students and your upcoming juniors as well. And the students somehow though they could not do due to multiple reason that we are not discussing. There are multiple reason for not getting through this one. But when you see and when you face the harsh reality that if you work hard, you will get through this. Somehow 80% of the students are not able to do, but 20% have done it. If they have not got into this, let's say, other side of the, this examination, in coming events, in coming attempt, definitely they will be get
Yeah,
no,
surely,
be
surely.
this one. with the right kind of advice and with the right kind of seniors like you.
Yeah, of course.
Hello, nice talking to you. All the very best,
Thank you
and
so much, sir. Thank
see
you.
you around as a pediatrician very soon.
Thank you, sir. Thank you so much.
All the very best. All the very best.
Thank you.
Bye-bye.
Thank you.